And since the outbreak of the pandemic, half of the world's student population are still struggling to go back to school. In Botswana, we know that the closure of schools has affected and impacted about 900,000 learners in both the public and the private primary and secondary school level. On behalf of UNICEF globally, and in particular UNICEF Botswana, I take this opportunity to applaud the government and people of Botswana for being amongst the first countries in the Eastern and Southern African region to reopen schools during the COVID pandemic. We know that the government and other stakeholders have adopted a couple of strategies to ensure continuity of learning amidst the pandemic. Today's Chalk Talk is bringing together government officials, development partners, academia, civil society to engage on what our experiences in the times of COVID have been, to share lessons and engage on how we can better ensure that quality education continues in spite and despite of COVID. Why is it important to keep open? I'm sure I'm speaking to the converted, bearing in mind the audience that we have today. But as UNICEF globally, we advocate for the reopening of schools and keeping schools open because we know that disruptions to instructional time in the classroom can have a severe impact on a child's ability to learn. Furthermore, we know that the longer marginalized children are out of school, the less likely they will return. We're starting to see the risks where these same marginalized children have had to start to be employed informally in the informal sectors. And once that happens, it becomes very difficult for them to rejoin school. Furthermore, we know that being out of school increases the risk of teenage pregnancy, sexual exploitation, violence, and other threats that impact very negatively on the rights of children everywhere. Further, prolonged closures disrupt essential school-based services such as immunization, school feeding, mental health, and psychosocial support. And we know that overall, these can cause stress and anxiety due to the loss of peer education and disrupted routines. Indeed, these are times when young people are socializing most, making new relationships in schools, and this has all been disrupted thanks to COVID. These negative impacts will be significantly higher for marginalized children, especially those living with disabilities and those in remote areas. As we look at the reopening of schools, we need to remember that of paramount importance is the safety of children and staff in the schools. This should remain a key priority for all of us. I'm pleased to let you know that in April of this year, UNICEF, UNESCO, the World Bank, World Food Programme developed guidelines on reopening of schools during COVID, and this same guidance was updated later on in September. Countries, including Botswana, I'm pleased to say, have contextualized these guidelines as they continue to further reopen schools. In addition, we know that WHO has developed guidance on school health during COVID-19. I'd like to urge all of us as we have today's discussion to continuously remain focused on the importance of the quality of education and learning for all children, including those with disabilities. We know that countries have developed catch-up programs to support learning, as well as to reach children that have not yet accessed learning during lockdown. During lockdown, many countries such as Botswana made use of alternative learning and teaching platforms to access children. These alternative platforms included radio, TV, print, and online teaching and learning. On that note, I'm excited to share with you that UNICEF launched the Digital Learning Toolkit on the 8th of this month, just last week. And this toolkit is designed to enable education stakeholders to follow a human-centered design process to develop impactful ICT for learning and EdTech solutions. We also know and recognize that not all children have access to these online learning platforms. In Botswana specifically, we know children are enrolled in the early childhood education sector and centers, and that some of them have disabilities, but these are sectors that have not always had access to education in the post-COVID era. In conclusion, I'm challenging all of us today, therefore, to engage in what we can do as Botswana to ensure that even as this pandemic continues to plague our country and indeed other countries around us, all children in Botswana must continue to have access to quality education, whether they're in remote areas or whether they have learning disabilities. Honorable Assistant Minister, on behalf of UNICEF, I'm hereby committing to continue to support the government of Botswana in her efforts to ensure quality education at all times. And I'm challenging all of us who are on today's webinar to play our role to ensure education for all. Ula, I thank you.